Welcome to the AUA Leadership and Business Podcast, where urologic professionals experience the practical application of business acumen essential to successfully navigating today's rapidly changing business environment. In this episode, Dr. David Green joins host Dr. Micheal Darson as they discuss why it's important to understand the language of finance.
Welcome for another episode in our series focused on the financial management aspects of clinical practice. I'm Dr. Micheal Darson, a practicing urologist in Scottsdale, Arizona. I'm finishing up my tenure as the AUA's practice management chair. Today, we will be addressing the value of understanding basic financial information as it relates to your practice or the organization that employs you. I'm excited to have with me today a true expert on this topic, Dr. David Green. Dr. Green completed his urologic training at Yale University, during which time he spent a year working at St. James University Hospital in Leeds, UK. Following residency, he joined the faculty at Yale and was an early AUA scholar. In 1987, he joined a two-person private practice in Concord, New Hampshire, which has grown to 9 urologists and 8 advanced practice providers. In 2006, Dr. Green became the first CMO of Concord Hospital and organized the Concord Hospital Medical Group, tripling the size of that group during his 14-year tenure. He also served as the CEO of a 5-hospital Medicare ACO, New Hampshire Accountable Care Partners. He recently completed his 4-year term as treasurer of the AUA. Dr. Green, welcome.
Thank you very much. It's a pleasure to be here.
Well, let's go ahead and get started. Let's talk about the rationale behind understanding these financial principles. Most of us went to medical school because we had little interest in business, accounting, and finance. After 9 years of medical school and residency, why do we need to develop that interest?
It's a great question, Michael. And I think to really illustrate that, I'll share a little story about myself. So, as you said, I did my residency, I stayed on an academic faculty. Um, and then after a few years, I joined a practice in Concord, New Hampshire. So, like most practices, I spent a couple of years as an employee before they made me a partner. And I knew the partners sat down twice a year and distributed the assets of the practice as a bonus to each of the partners. So, as you can appreciate, I'm pretty psyched. It's going to be my first partner meeting. And we sit down with the accountant, and the accountant says, "Oh, you had a great 6 months. Um, there was $100,000 worth of profit." Well, I'm sitting there thinking, 100,000. Well, that means I'm going to get to go home with $33,000. I'm really pumped. And then at the end of the meeting, the two old partners say, "Well, how much should we distribute? 5,000?" And I said, "Wait a minute. We had a profit of $100,000, but we're only going to take home 5,000?" And the accountant kind of looked at me like I had three heads because I didn't understand the difference between profit and cash. And that was sort of my epiphany that although I had a pretty good urologic training and I felt pretty comfortable as a clinician, I had a lot to learn about the business side of things. So I think the rationale here is we can feel confident in our urologic skills, but for most of us that didn't go and get an MBA during medical school, we're now faced with a new world, a new vocabulary, and there is no Google translator that we can turn to that leads us.
So, what elements of finance should the average urologist know?
Well, like I said, Michael, it's unrealistic to become an MBA. Um, but I do think there's four areas that it's pretty important for a urologist to understand. And the first is the error that I made or didn't understand, and that's the difference between accrual accounting versus cash accounting. As you know, cash accounting is what we do with our checkbook at home. It recognizes transactions only when payments are made. Accrual accounting, on the other hand, recognizes revenue and expenses when they're recorded, when the transaction occurs, not when a payment is received or made. So, understanding the difference between the two accounting systems is the first area I think a clinician needs to become familiar with.
Dr. Green, can I stop you right there for a quick question?
Sure.
Why is it important to understand the difference?
Well, I think as my illustration demonstrated, if you're used to thinking about your checkbook, it doesn't make sense then when you're looking at a profit and loss statement and you're thinking, "Oh, that's revenue," when it's not, or that's cash when it's not. So we'll talk a little bit more about that, but I do think. It's a fundamental different way of recognizing financial activities that most of us are just not, particularly coming out of training, inherently aware of. So the second area I think is important to know, just like you need to know the vital signs of your patient, blood pressure, pulse, temperature. Well, there's vital signs of your practice or of the healthcare institution that employs you. Um, and those vital signs are the balance sheet, the income statement, and the cash flow statement. Terms most of us have heard, but not always things that, again, the average urologist is really comfortable with using. I think the third thing, and this is particularly true for those of us employed by a healthcare institution or find ourselves in an academic institution, and that is budgeting. Um, um, what influences the process in your organization? How is the budget put together? Um, what are the ins and outs of that? Um, that's an important concept, and we'll talk a little more about that. And then the fourth area, I think, which is really critical, is understanding the dynamics of your revenue cycle, uh, particularly if you are in an independent or private practice. Um, what's your billing effectiveness? How are they doing it? It's great to do the work, um, but if you don't get paid for it, all is for naught. And you need to do it well, or you're going to have some very upset patients. So those are the four things I think we need to focus on in today's discussion at a high level. Um, but that's the direction I would lead a colleague who was trying to get their arms around some of the financial aspects of urologic practice.
Okay, you discussed what you consider to be the vital signs of the organization. Why do you consider the balance sheet, a profit and loss statement, and the cash flow statement the big three?
Well, no matter what you're doing, whether it's interviewing about employment or joining a practice, understanding how your practice is doing, um, you have to have some way of understanding that. So these three um, different financial statements are the key to that. Not just the key to your practice, but as you invest your assets, your retirement plan, things like that, being able to evaluate the strength of a company you might be looking at. These are universal. So the balance sheet, which is the first of the big three or the first of the vital signs, that's going to give the person a static picture of an organization at one point in time. And all the balance sheet is, it tells you what is owned and then what is owed, as well as the equity that the shareholder or the urologist in his or her company or practice may have. Those two have to balance. So what it does for us, it shows us the capital structure of a business entity at that specific point in time. It's not a dynamic, you can't get a directional sense from it, but it does answer whether or not the organization has a positive or negative net worth. It tells you whether the assets are adequate to cover liabilities, and it will also allow you to see the degree of indebtedness that an organization has. All are key components, whether you're looking at a practice or you're trying to understand where it is. But as I said, it's just one point in time. So the second of the big three, and the one that most of us are going to be seeing perhaps on a monthly basis with our practice managers, is going to be the income statement, or it's also referred to as the profit loss statement. Here, you're looking at revenue. And again, I'd emphasize it's not not cash receipts, it's just revenue. And you're looking at operating and non operating revenue. Now, one of the things I would tell the AUA board, though, you always have to pause and look at what the statement is referring to. So we talk about AUA as example as one organization, which it is as members as we look at it, but there are actually four separate corporate entities underneath the AUA, AUA ER, AUA Inc., the foundation, and now the PAC. And each of those four entities will have a balance sheet, an income statement, a cash flow statement. And so I would oftentimes stress to a board member, you need to first ask, what are we looking at? Is it the consolidated of the whole, or is it one of those four entities? And for members that may work in a hospital system or even in a large urologic practice, there could be more than one income statement, profit loss statement that has an impact on them. So this one is really the statement that is used to guide the management of your practice. And if you had to spend the most time on any one of these, well, this to me is the one. So it'll give you insight into operations by program or department. It's going to allow you to see the underperforming areas of your practice. It'll give you an ability to evaluate the efficiency of your management team. Is your practice manager doing his or her job? It'll give you performance relative to budget and previous years. Now, for those of us that may be practicing in a hospital system, the budget can sometimes be used as a cudgel. So we'll talk more about it when we talk about the budgeting process. But understanding how you're doing compared to that budget that you've been given becomes critical. And so it really becomes the key tool for managing your practice. So high level, it's the balance sheet, it's the income statement, and all of those are based on accrual accounting. But cash is king. And so the third statement in the vital signs of your practice is the cash flow statement. And here it's critical to understand you're back to now cash accounting. And your cash flow statement will aggregate the data so you can see where your cash comes from, where it goes to pay for activities and for investments. And your typical cash flow statement will have three components. There'll be one related to operations. There'll be a second one, cash flow related to investments. And that doesn't mean necessarily stocks and bonds, but you might be investing in a surgery center or you might be investing in real estate. And then the third thing that you'll see on a cash flow statement will be the financing aspect of things. And most practices are going to have some loans or mortgages or those kinds of things. Um, and the cash flow statement will allow you to see where you are.
All right. So, would you agree that equally important to understanding the big three is also understanding the budgeting process and what influences that process in your organization?
Yes. Well, I played Division III basketball, and my job was to be Dennis Rodman, without the dyed hair, without the tattoos, and without the talent. It was not a very glamorous job. And putting a budget together, particularly within a large organization, is not a glamorous job. And yet, for the 60 to 70% of our members who are either in academics or employed by a hospital, or even for a large urology group person where they may have um, multiple practice sites, um, your budget is going to dictate how you're going to get paid, but it's also going to dictate how you're going to be evaluated in your performance. So it becomes really important, and particularly as healthcare organizations like hospitals get stressed, um, it can be used as a cudgel at those monthly meetings, saying to you, your RVUs are not where they were supposed to be. You're not generating the revenue that you said you would, et cetera. Well, if you haven't set those budget figures or you haven't had a say in it, that's a recipe for disaster. And when you think about our specialty, it's small. So when it comes to budgeting on an institutional level, you're up against cardiology, you're up against orthopedics, typically service lines that have much more of an impact and get a lot more attention from administration. So it becomes critically important that someone in your practice, not all of you, but someone's got to be there and active in the budgeting process. Because as we often say in political action activities, if you don't have a place at the dinner table, you're going to be on the menu. Um, but I would submit this is more life and death for you and your family in terms of how it's going to impact your bonus at the end of the year, and just how you feel about what you're what you're doing. So um, it was frankly one of the reasons when we sold our practice to a hospital um, that I got involved with administration and became a CMO. Because you start to know where people are coming from, what the stresses in your organization may be, what the internal politics, and like rebounding, uh, that metaphor, there are times when you have to get your elbows up in the budgeting process. You better know what the organization and your practice's strategic plan is. So, um, again, it's not glamorous, but I think it behooves all of us um, to get involved, be a active participant, a knowledgeable participant in the budgeting process, and to also understand the difference between how the capital budget is arrived at um, and the operating budget, because they're two very different things in an organization beyond the scope of this podcast. Um, but there will be different rules, um, different valuations that will assign an expenditure to either the operating budget or the capital budget. So I'm making a pitch here. Um, get involved with the budget, or at least get someone in your office passionate about participating.
Okay, you've done an excellent job of covering several things. You've covered the three of the four elements of finance the average urologist should know. First, the basics of accrual accounting versus cash accounting. Two, how to interpret balance sheets, P&L statements, and cash flow statements. Third, understanding the budgeting process and what influences that process in their organization. What about the fourth element, the revenue cycle? What does the average urologist need to know about the revenue cycle?
Well, um, for all of us, we work very hard, and it's a stressful job. And I don't think anyone would disagree with me when I say we earn our keep. Um, but at the end of the day, you do have to get paid for what you do. And just because you've earned it, just because you've put in X number of RVUs, it doesn't mean you're going to get paid for it. So you can think of this almost like the quality control, if you will, for the billing side of your practice. How efficient, how effective are your billing people or your collection staff? And and how does it impact your patients? How are they interacting with your patients? Are they making them angry? Angry patients tend to sue. Um, and it undoes all those relationship building you've done in an exam room or in a hospital. So, for the health of your practice, no matter what the practice site is, you really need to be aware of your accounts receivable and how they're trending. If they're going down, good. If they're going up, what's wrong? You need to look at your insurance denial rates and the whys. Do you have issues with the way charges are being captured? Um, um, Collection rates. How good is your staff at doing that? What are the discount rates that your payers are um, um, contractually um, giving you? Um, and then you need to understand the payer mix and how that changes. So if you start to see that your practice is becoming more and more a Medicaid or a Medicare practice, that is not going to bode well necessarily um, for your financial performance. And watching that and seeing what of those shifts are occurring become important as you try to course correct your practice. And then days cash on hand. Um, if you get into trouble, for example, we go back to March of 2020. All of a sudden, with COVID, the bottom just dropped out of the market. Um, and all of a sudden, you may have seen your payments not coming in efficiently. Well, you still had to pay your staff, you still had to pay yourself. And so um, it's important to have cash on hand to be able to do that. So I think, again, being able to critically analyze and monitor your rev cycle would be the fourth element that I think the average urologist needs to understand. Um, and again, not something that we are inherently brought up with during our residency. And sometimes, if we just come out of training and we say, "Oh, we're employed, we don't need to worry about that," you can get into trouble, or your organization can get into trouble. And I know a few people who have been employed, for example, and their hospital has actually gone under. Um, and then it becomes kind of a crisis in their life and their family's life. So um, you just need to constantly be vigilant. And I think if you focus on these four things, you're off to a pretty good start.
So, Dr. Green, let me give you a hypothetical. Say we have a listener that's suddenly realizing after this excellent summary of finances how little they know. What would be your recommendation for how to get more information on this and how to learn more about it?
Well, I think the great thing here is the AUA's creation of the Institute for Leadership in Business. And this podcast and the excellent ones that preceded this during this podcast season are a great start. There's courses now at the annual meeting. I think you can also go to things. I still use Investopedia.com. It's a great place to go to get definitions of things, terms you may not understand. Um, there are myriad books. Accounting for Dummies is a sort of an entry level um, resource, but there is no substitute for relationships and getting to know your accountant. They love it when you show an interest. Um, and as long as I think you go in understanding that you don't understand, um, they can be a great ally. But you can't divorce yourself from the responsibility of understanding these things, or you will find yourself getting into trouble.
Excellent recommendations. Dr. Green, thank you for joining us today to share your expertise. And as I understand it, you were the guest for the inaugural episode of this podcast series that focused on the critical connection between finances and delivering high quality care. It's been great to have you back.
It's great to be back, and I'm just exceptionally proud that the AUA has recognized this pressing need for our members and is striving to meet that. And thank you very much for the time, Michael. It's been great talking with you.
It's definitely been my pleasure. Thank you to our listeners for tuning in to explore this important topic with us.
Thank you for listening to the AUA Leadership and Business Podcast. Subscribe today by searching AUA Leadership and Business on your favorite podcast app to enhance your business skills, activate your interest in business and finance, and inspire the leader in you.